From the campus of the University of Kentucky, you're listening to Behind the Blue. I'm Kody Kiser with UK Strategic Communications.
It's important to be able to ask the question, are you feeling like hurting yourself? Have you had thoughts of wanting to die? And those kind of questions, those are hard to ask someone. It can be actually very normalizing and validating to give someone the space to say, yeah. What we don't want is to ask the question of like, you're not wanting to do anything to yourself, are you? Because that sort of plants the seed that you don't want to hear an honest answer from them. You want to open the door and say, it sounds like this is a pretty difficult situation. Have you ever had thoughts about hurting yourself or not wanting to go on or feeling like this is really hopeless? Asking those questions directly is really important. A lot of times people don't ask because they'll say, oh, I don't know what to do if they say yes. If the person then says yes, your role is not to provide services to them, it's to connect them to services. It's to call or text 988. It's to get them to Empath. It's to call someone, help them get connected with a therapist or, somebody else that can get them those services. And that's a really important part of that role is, will you go with me? I want to help you get help for this. This is treatable.
That's Dr. Lindsey Jasinski, one of the key leaders behind UK Healthcare's Empath Unit at Eastern State Hospital. September is Suicide Prevention Awareness Month. Of open, honest conversations about mental health and the resources available to help those in crisis. Empath, a low-barrier 24/7 mental crisis emergency unit, is changing the way patients receive immediate, compassionate mental health care, and why that model is quickly gaining national attention. On this episode of Behind the Blue, UKPR's Allison Perry joins Dr. Jasinski and Dr. Marc Woods to discuss their decades of experience in behavioral health and suicide prevention, and share how their team is helping Kentuckians find hope during some of their most vulnerable moments. They also talk about the alarming prevalence of suicide, particularly among young people in Kentucky, and offer actionable insight on how to support someone who may be struggling.
Dr. Lindsey Jasinski, who's the Chief Administrative Officer for Eastern State Hospital, and Dr. Marc Woods, who is the Chief Nursing Officer for Eastern State Hospital. They also run UK Healthcare's Empath Unit, which we will get into a little bit later, but thank you for joining me.
Thanks for having us.
Yeah, thanks for having us.
And we've got a very serious topic to cover for this episode, which is focused on suicide prevention. Before we get into that, if you could both just kind of briefly tell me about your experience in mental health care. Marc, I'm going to start with you because I believe you've been with Eastern State for, was it 30 plus years?
Yeah, so I've been in behavioral health for 32 years. Most of that has been with Eastern State Hospital and, of course, UK Healthcare approximately 13 years ago. Had the honor to be a part of that piece as well, that expansion of responsibilities, and most recently the opening of Empath. And I've had a lot of different sort of endeavors into the topic we'll be talking about today, suicide. How do we increase awareness of suicide? How do we decrease suicides themselves, both externally in the community, but also internally within our own organizations? I've done some research there as well.
Yeah, so I haven't been here 32 years quite yet, but I have been with UK Healthcare for 15 years. First as a clinician, I'm a licensed psychologist by background and training, and now in a leadership role for the past about 10 years in various leadership roles. And I have served in different areas of the organization, working with substance use, inpatient and outpatient mental health. And across all of those areas, suicide impacts not only the patients, but our colleagues across the organization as well. And so a lot of the work that we do involves consultation and how do we support our own colleagues, how do we support our community, and how do we support the patients that come to us. Suicide continues to be a concern in the community, and it's hard to not be touched by suicide at some point.
I'll kind of jump right in, and I was going to ask you kind of about the prevalence of suicide, and just to tell you my own anecdote. I knew someone who died by suicide. He was in high school. He was my sister's friend, and I was like 12, and remember feeling like this is a thing that happens. Like it was being like very confused and young and not understanding that someone would do that. But I think it seems to be more prevalent than most people realize. Is that the case?
Absolutely. Statistics show that this is a significant problem. And we know in Kentucky and nationally as well that suicide is the second leading cause of death for ages 10 to 34. So it's something that affects many, many families. The rates of suicide nationally are about 14.2 individuals per 100,000. In Kentucky, that's actually higher. It's 17.5 individuals per 100,000. So we lose in Kentucky over 800 individuals a year to suicide. We don't hear about these. The news doesn't really report these, or we talk about them differently, or because of stigma, it's hushed and it's tucked away. But we have to talk about this topic because we are losing family members, and it's a preventable cause of death if folks can get access to care and intervention with specialists.
Yeah. And the only thing I would add is we recently opened up the Empath Crisis Center here at UK Healthcare, and we served about 5,000 people within a year. And of that 5,000, 2/3 of the people that presented to get services were suicidal or having thoughts of suicide. And so we have both a national, we have a state, and now we have a local sort of affirmation that this is an issue that we have that is prevalent and that we need to manage it.
I think what's important to remember too is this could be any of us. I mean, it could be our family members, it could be our friends. Many times we don't know unless we ask those questions specifically, what's going on with someone. And you hear stories and think, gosh, that could have been my kid, or it could have been my family member, it could have been my colleague. We just oftentimes don't ask the questions, or we don't observe the signs to become aware and be willing to have that conversation.
And you mentioned the stats that Kentucky's known for a lot of not great things in terms of healthcare, but suicide rates being higher than nationally. Do we know why that is, or we have theories?
Yeah, that's a tough one. I will say it's multifaceted. I do think when we look at some of the poverty, I think sometimes when people live in poverty, things are much more difficult and challenging, or can be. When there's a lack of resources, Kentucky has a lot of different sort of healthcare sort of deserts where it's really a challenge for people to get to services and access those services. We've made some improvements with telehealth, I think, over the years for sure, but there's still parts of Kentucky that has lots of areas that are just underserved and, most importantly, under-resourced.
I think mental health rates in Kentucky, about a quarter of adults will experience some sort of mental health need. And that's certainly correlated with suicide, but not exactly, right? Someone can have thoughts of suicide because of a major life event that happens where they've never had a mental health need before. I think it's also important to point out that about a fifth or 20% of the youth in Kentucky also experience depression, and those rates have been rising. And so we know that there are lots of vulnerabilities. Substance use is another factor that can contribute to thoughts of suicide. So like Marc said, it's very multifaceted, and that makes it a challenging problem to address, but it also means we need a lot of people willing and trained to talk with folks about suicide.
And you mentioned, suicidal thoughts, suicidal ideation. And do we have stats on how many people may have just thought about it and not acted on it?
Yeah, so nationally, we know that about in 2023, coming from the CDC, we had about 12.8 million that had serious thoughts or that admitted to serious thoughts, and about 1.5 attempted. And so then, of course, Lindsey earlier told us about the number of people that had died by suicide. So we know it's a pretty prevalent, it's actually more common than people realize. And so I think Lindsey earlier talked about all the ways that people may relate to this, your children, your neighbor, your spouse. But I think the most important one is, I think some of the people hearing this today will have experienced this themselves or had thoughts of that. So it's pretty prevalent.
We interviewed Bruce Simpson last year for the Eastern State 200th, and he's very open. But one thing that stuck with me was he had said that all his life he kind of thought that he would kill himself at the first time I make a big mistake, I'm just going to do it. And I asked him, did you think that was normal? And he's like, yeah, just what I thought. And is that typical? Do people understand what what they're thinking.
Yeah, I think
it's not great.
Yeah, no, I mean, I think when you isolate yourself and you don't share your thoughts or share your feelings, right? I mean, it's real easy to sort of ruminate and hyper focus on that, and to think that what you just said, this is very normal thoughts to be having. But truth be known, I think the majority of individuals may have moments in their life when that's more prevalent than others. I do think there are subsets of individuals who their entire life they may think of, have those thoughts and not share them.
And I think it's important to recognize that thoughts of suicide are a solution to a problem. And the problem is usually feeling very hopeless or feeling like you can't escape a difficult situation. And so when we respond to those things, we think of how do we build coping skills? How do we use resources to build a plan so that when you're in the heat of the moment, something happens and you're feeling overwhelmed, you already have something written down. But suicidal thoughts in and of themselves are thoughts, right? They are, I don't feel good in this situation and I need a way. I need to know I have a way to escape. And that is an ultimate escape from a situation. But there are ways to cope that folks can learn and practice throughout their lives. But I think it's important to normalize some of those thoughts too. They, they're signaling to you that you're struggling and you want to be able to cope with this situation differently.
There's research out there that supports exactly that, is that the way that you combat stigma and sort of just this almost shame sometimes from mental health is to share your story. And sometimes it's not only sharing your story, but sharing the story of other loved ones as well to sort of normalize that conversation. That's been shown in many, many studies to reduce stigma at such great levels. And if I had one thing to share today, that would be share your story. Yeah.
To go back to coping. So let's say if someone's listening to this and they have had kind of some sort of persistent suicidal thoughts, what's like a first step that they can take?
I mean, certainly there's options like 988. If those thoughts are really invasive and they're kind of consuming your day, there's Empath, there's local resources, but there's also lots of apps. There's Virtual Hope Box, there's Code Red training, which basically Code Red says we want everyone to have a coping plan. So, the simplest way to do that is to write down 2 people that you can contact and 2 coping skills. If right now you were in a very difficult situation, I could do these 2 coping skills: deep breathing, take a walk, color, do something distracting, or 2 people you can contact to say, hey, I'm having a hard day. Can you meet me for coffee? Can we talk? Those kind of things. Call, text, whatever. But that's a very simple coping plan. Code Red is one of those options, but there's lots of apps and lots of opportunities for people to say, I'm going to plan ahead because I never know what tomorrow might hold. And so I'm going to have a plan for who I'm going to contact or what I'm going to do if I'm feeling overwhelmed.
Yeah. Lots of studies too. Lots of studies have shown even before you get to that point or a contributory sort of point is to focus on the right diets, the right exercise, the right sleep patterns. And sometimes those studies have come back, actually not sometimes, it's an exceptional number of times, the studies have come back showing just as good as results as sometimes other more conventional methods like medications and things like that or therapy. And so really paying attention to your sleep, paying attention to your diet and exercise can be a big part, play a big role as well.
Mm-hmm. Reducing vulnerabilities. Mm-hmm. Yeah. Mm-hmm.
And so what about if, you're on the receiving end of a call from someone who's expressed that they're seriously thinking about it? What can you do as someone like a friend or family member support system?
Yeah. One of the best things to do is, first of all, get trained in QPR, which is Question, Persuade, Refer. UK offers that for free for any Kentuckians. And what that does is like CPR, right? We're trained on how to respond in an emergency. What QPR teaches is how to listen, how to validate. That sounds really hard. And how to ask questions. So you might have someone come to you to say, I'm having a really hard day. I just feel like I can't go on, or something to that. And it's important to be able to ask the question, are you feeling like hurting yourself? Have you had thoughts of wanting to die? And those kind of questions, those are hard to ask someone.
I read that and I was like, that seems so blunt, but I guess you should get to the point.
Yeah. And it can be actually very normalizing and validating to give someone the space space to say, yeah. What we don't want is to ask the question of like, you're not wanting to do anything to yourself, are you? Because that sort of plants the seed that you don't want to hear an honest answer from them. You want to open the door and say, it sounds like this is a pretty difficult situation. Have you ever had thoughts about hurting yourself or not wanting to go on or feeling like this is really hopeless? Asking those questions directly is really important. A lot of times people don't ask because they'll say, oh, I don't know what to do if they say yes. If the person then says yes, your role is not to provide services to them. It's to connect them to services. It's to call or text 988. It's to get them to Empath. It's to call someone, help them get connected with a therapist or, somebody else that can get them those services. And that's a really important part of that role is, will you go with me? I want to help you get help for this. This is treatable.
Yeah. Yeah, just to reiterate what Lindsey said, the QPR, it's about a 1-hour training. It's free. There's been a lot of Kentuckians so far that's taken this course, and they almost always come out saying they're so glad they took it. They feel more comfortable. They can also imagine themselves being more confident to say exactly what Lindsey said, are you having thoughts of hurting yourself? And that's a pretty big one. The other part too is staying with them, but also removing them or putting space between that person and any sort of lethal means. This is where we kind of talk about, the impact of guns. Guns account for about 2/3 of suicides. And that's an important piece to this is if you're with somebody who's active, who is in a critical state, it's really important to sort of remove them from any sort of lethal means. So that may be taking guns and putting them over to a neighbor's house or another family member's house, things like that.
Medications, making sure that, do you have access to those things? Do you have access to medications? What can I hold on to for you or get someone to hold on to so that we can put space and time in between there.
And what would you say to people that I think a lot of times it might be like a boy who cried wolf kind of situation where people kind of dismiss it like, oh, they just want attention. Like what would you tell someone to kind of convince them that like, this is something you should take seriously?
We would take somebody who's saying they have chest pain seriously, right? And we would get them evaluated and get them services. If they're saying, they want to hurt themselves or they are feeling hopeless, at the very least, what they're saying is they're overwhelmed and distressed, and getting them to help is still important because whether, they are going to follow through or have intent to follow through on those thoughts now, that can change very quickly. And so anytime somebody's talking about these things, there's risk that they could try to hurt themselves at some point. And so it's still important to get them connected to help and get them connected to any services that are available to them.
Yeah. I think anytime somebody is making comments like that or statements like that, it's a cry out for help in some way, whether they're truly suicidal or not. That's really shouldn't even enter our minds. It's not up to us to sort of make those decisions. Just follow some of the guidelines we've talked about to get them to services, get them to professionals who can make some of those delineations and move from there. Yeah, I mean, it's none of us would ever want to be on the wrong end of that decision, right? If somebody came to us and said, hey, I'm having these really bad thoughts. I feel like I'm a burden to everybody. You'll hear them, maybe it'll show up in their language. Sometimes it'll show up in their moods, but feeling like I'm a burden to my family or I don't make a difference in any setting that I'm in. I just don't feel connected to people. That's some of the language. And then if they follow that up with saying, admitting that I'm having thoughts of suicide, hurt myself, to try to make that call as to whether or not that person's serious or not. It's not really even a part of the game. It's all about staying with them, being brave enough to ask the questions. And then, as Lindsey said, get them connected to the next step, next services.
Let's talk a little more in depth about resources, and let's start local. So here in Lexington or Central Kentucky, I guess, I know Empath is the big one we want to talk about, but other potential ideas that you would give?
Well, we love talking about Empath. We'll talk for hours about Empath, but maybe we first start with 988 because that's one of the easier and more sort of prevalent, and every person in Kentucky should have access to that. 988, and that can be a call or that can be a text. You can actually text 988. And so now all of those all of those sort of calls are routed to the local CMHCs, the community mental health centers, and they're managing a lot of that work. And so that's a resource that we should all know, we should all be aware of, and we can kind of like help other individuals get connected to that.
And I think it's important to point out too, often people will fear calling or texting 988 because they think that's going to result in hospitalization. The data has shown now that we've had 988 that more than 95% of those calls are resolved on that call or with that text message stream. So very few individuals actually end up having any escalation of services that's needed from those calls. So don't let that be a barrier to contacting or reaching out for help.
And this came out more than a couple of years ago. It's been out for a while now. And when it first came out, there were some challenges and some hurdles. It wasn't as efficient as we had hoped it to be, but it sounds like, as time has gone on, we've gotten better as a state, gotten better and better at getting people connected to those services, answering those calls.
Yeah, and I think it's important to know too, NAMI, the National Alliance for Mental Illness, has local chapters. There are several. There's NAMI Kentucky, there's NAMI Lexington. But that's always a good resource, particularly for family members. If they have someone they know, they have a loved one that's struggling and they want to reach out and get resources, that's another local resource. And then, of course, any healthcare organizations. There's places in Lexington. New Vista now has an urgent care. There's other urgent cares where you can walk in and get an appointment that day. So you don't have to wait. A lot of times people haven't sought services because they think, well, I'm going to have to wait 6-8 weeks plus to get an appointment. And that's true still some places, but there are always options here and really across the state. These are growing where you can walk in and get services that day.
And speaking of such, we are particularly fond. We're particularly fond of Empath. We opened Empath about a year ago. Served about 5,000.
Can you, if someone is listening to this and they aren't aware of what Empath is, briefly kind of describe what it is?
Yeah, it's Emergencies Psychiatric Assessment for Treatment and Healing Clinic is what it stands for. The easiest way to describe its intent is to be a very low barrier resource. It's 24 hours a day, 7 days a week, holidays, weekends, you name it. It's always there, and people can come up if they're having some sort of psychiatric crisis, mental health crisis. In this case, if they're feeling like they're having suicidal thoughts or they're with a family member that's having suicidal thoughts, all they have to do is just drive them up and get them to the facility. And then it's a 23-hour service where patients stay with us for usually no longer than 23 hours. Sometimes they go home after 12 hours or 15 hours. And we're making a determination as to whether or not they need further help. Do they need to be admitted for a longer, more intensive help? Or can they be discharged back home? And about 76% of those people that come in to see us are discharged right back home within hours, about an average of about 15 hours, actually. And so what they leave with, though, is any sort of medication changes that might have been needed or started. And then the most important part is that they're connected to outpatient services. And we work really closely with some of our partners out in the community like New Vista to provide us those things. And so patients are leaving the organization and usually being able to be seen within 24 to 48 hours.
And so I remember we did a patient story last year, and it wasn't related to mental health. I think it was maternal fetal, but the patient said that she came here because she was having trouble getting her prescription renewed. And she's like, I'm about to run. And she came here to have that done. And she just raved about how great your team was.
Yeah. It's meant to be access, right? It's meant to be, it doesn't matter how sick you are, what you need. It's also meant to be different from the emergency department, which historically has been where folks would go when they're in a crisis, whether it be substance use or mental health. And it's entirely different from the emergency department. We start treatment the minute they walk in the door. They're seeing behavioral health professionals. That includes individuals like social workers and peer support specialists who have been in those situations and can say, I've had this experience. I've been where you are, and here's how I got through it. And that's hugely impactful for someone who's struggling. It's meant to be calm and quiet, and our folks, our behavioral health patients, are prioritized. They are the priority. We want to provide care that meets them exactly where they are. And if that's what they need, then great, we can provide that.
Have you gotten any feedback directly from patients who've been here?
We get a lot of positive feedback that this is just what our community has needed. In fact, it's more than just this community. We get patients that have driven from other states to be able to get this level of low barrier access. And that's what they talk about. You don't have to call and let us know you're coming. You don't have to get approval from your primary doctor. You just come in, and then we, like Lindsey said, we meet you where you are and we start a care plan and go from there. So yeah, that's the feedback has been from our paramedicine teams, our fire department, our police, other hospitals have just raved about the access, really, the ability to come in and get seen. And just as you said earlier, whether it's just I'm about to run out of my medications or full blown, if I don't get help or get some sort of supervision, I'm going to harm myself. So we see the whole spectrum for sure.
We've had families say, I couldn't get this person to go to the emergency department because anxiety and panic didn't feel like a reason to go to the emergency department, but they could come here. They could get them to come here, and we can treat that. We can stabilize them and get them back to school or work or caring for family members or whatever it is that they do in the community. And we don't have to disrupt their lives. We can still get care, get the treatment that they need, and be able to go back and do those things that are important to them.
I was going to say, and my name is on the media advisory as the media contact. So I get emails from people a lot. And I got so many emails in the past year from people saying, can we talk to the team that opened Empath? And I didn't know if you've had those conversations and like what it's like to kind of help other organizations maybe try to set up their own Empath unit.
Oh, wow.
We've met with more than 50 different organizations, a lot in Kentucky, a lot nationally, some even internationally.
Help you set one up.
Yeah. It's a growing model, and I think it's founded in the right values of we're going to meet people where they are and how do we get services that are easy to access. When we have services in the community where if I'm a loved one, I have to decide which service is appropriate, I don't know, right? I can't make that decision. And so the low barrier, we take anyone and everyone, means that if I have a family member in crisis, I know where to go and they will help figure out what's the next step, not me trying to figure out where to get that person help. And that has been, it's a growing model nationally that I think we're going to see in a lot of different places. And I think that's going to change some of the trajectory that we've seen on suicide rates continuing to increase year over year. Our goal is to make a difference and help impact that across Kentucky, where we see those rates start to come down.
But I was going to ask, so if you don't live in central Kentucky, or if you don't have the means to drive here, let's say from another state, but are there other in-person resources that are relatively easy to access out throughout the rest of the state, or any coming soon?
Yeah, we can talk about that. So we've as Lindsey said earlier, we've kind of partnered with other organizations and regions, even across Kentucky as well. But I think too, a lot of counties have a different variation of a crisis stabilization unit, and so they're not in every county for sure, but there are a handful of these across the state. They are a little different. I mean, how you access those. I think that, but every community has a community mental health center, and so the ability to go through that community health center, like whether it's Pathways or New Vista or Adonta is another. Mm-hmm. I mean, there's so many across the state, but every county has a corresponding community mental health center that's important to engage for resources and information.
I think it's important to note, too, that Kentucky has regional extension offices in every county, and many times those extension officers are aware of the mental health resources in their community. We've actually started some work in partnership on how do we help them have more connections to those services so that they can serve as a liaison if somebody wants to reach out to their extension office and say, hey, where do I get help, or where do I get my loved one help?
I didn't know that.
Yeah, it's a great resource.
Mm-hmm. Extension offices do everything.
Seriously, they really do. They're amazing. But
lots of information.
Yeah, sure. They have lots of resources, and many of them know to reach out to other resources within UK if they need to access additional services.
With the popularity of Empath, do you feel like it's helped maybe reduce the stigma for seeking mental health treatment?
Oh, absolutely. Some of the stories I think that Lindsey alluded to earlier, the families that are coming to us and saying, we wouldn't have, our loved one wouldn't have gotten help had they gone to the emergency room. It's normalized. You come to Empath and you're greeted by a provider within probably 5 to 10 minutes. You're seeing behavioral health staff that's immediately engaging you. We have peer support specialists who are people with lived experience who work for us, who's able to kind of relate to the patient that's coming in. So yeah, we've got, it's, I don't know. I feel like we're kind of unique in that manner. We've got not just the family reports, but even the staff saying that this has been a rewarding place to work, and to be able to kind of come into contact with so many people in need and be able to help either connect them to that need or directly treat that need, for sure.
And when we talk with community agencies, I mean, we've talked about Empath a lot in the last year. When we talk with community agencies, we have had more than one occasion where somebody in front of their colleagues will say, I've been one of those 5,000 patients that you've seen, in multiple different organizations in the community, really, kind of highly publicly willing to acknowledge that they needed to get help. And that is so powerful in reducing that stigma and saying, I went and it was great. And I went back to work the next day, or I went and I got my medications refilled. I got exactly what I needed. We hear that often, and honestly, it's really humbling to hear some of those stories. And we've seen surgeons, we've seen high community officials, we've seen attorneys, we've seen, individuals who are living in homeless shelters. Really anybody in the community, we're able to serve and figure out how to meet their needs. And that's really cool.
Have to share one of those stories, though. We, as Lindsey said earlier, we oftentimes are speaking with other organizations that want to understand us better or want to explore doing what we're doing. And so we had a group that came in, and there was probably 30 plus of these people in front of us, and we kind of are given the spiel about what we're doing and how we do, how things work here and what are the operations like and so forth. Just trying to orient the organization. And one of the pieces of information we shared was that last year we saw like 5,000 people. We're super proud of that number. And we get to the end of this talk, and the gentleman told us, stood up and raised his hand. We thought he had a question. And he said, I wanted to thank you guys. He goes, I was one of those 5,000. And it just pulled everything out of you at that moment, because you felt not only that you knew you were making a difference, but just you saw it right in front of you, and the bravery that he had to share that within his own colleague group. But again, to us, it was just such an amazing story.
Someone may, and honestly, I've been in therapy many times, and I remember saying this to my therapist, I can't believe you have to sit here and listen to me. But the point being, people are here to help, and they want to hear your problems. I think that's an accurate assessment, and that people shouldn't feel like they're burdening someone if they come here for help. As a therapist myself, to sit with someone in a room when they're in one of their most vulnerable states is an honor in some ways. They're letting you in and saying, this is what I'm struggling with. And to sit there and say, I want to be able to help this person. I want to be able to, ask them questions so that they gain insight. I want them to develop coping skills. I want to help them live a life that they find fulfilling. And that's, as a therapist, that's an honor to be able to do that. And it doesn't feel like a burden. It feels like a shared vulnerable space where that person can say, here's what I'm struggling with. And it's such a human experience to struggle with things. Everybody does.
Yeah, I think with Lindsey, the honor and feeling like, they're in a special position, our staff are in a special position to be able to help somebody at honestly their darkest hour. And, Lindsey and I get a chance to kind of lead this group and oftentimes show up for interviews, but really the magic and the group that's working the hardest and doing the most amazing work is our frontline staff. Had a example where I was on the unit as a leader with a patient that was sort of getting upset about his situation. He wasn't really responding very well to myself. And I got 30 years of behavioral health experience. I'm like, I should be able to, work this thing out, and have most of the time, but wasn't having a good go of it on this particular day. And one of our peer support specialists, the statement was made was, you don't know what I'm going through. You've never gone through this before in your life. And there's a part of what he was going through, it was true. I couldn't say anything about that. But our peer support specialist walked up behind me and said, he can't, but I can. I have gone through what you're going through. And let me tell you my experience so that I can help you through yours. And so they do take it very seriously, their role. And that's really what makes this such a special place.
Is there anything else that, as we kind of wrap up here, that you all want to say either about Empath or more in general about suicide prevention awareness?
I would just say, this is Suicide Awareness Month, and there's a lot of different opportunities to get involved. And so if you're interested, if you've been affected by suicide in some way, there's lots of ways to get involved to learn more, but also to get connected with other people. So so a couple of examples. The American Foundation for Suicide Prevention holds these walks for awareness. They're kind of a community events called Out of Darkness. And Lexington will be having one on Saturday, October 4th at the Moondance Amphitheater. Check-in is at 9:30 a.m. They can find more information about it on the American Foundation for Suicide Prevention sort of website. And the only other thing I would add is if you haven't had QPR, really take that seriously. Consider taking it. It's 1 hour. It's everybody that goes through it says that it's just a wonderful thing and they're glad they've gone through it. So take that opportunity. It's free.
The only thing I would add to that is just to say one of the most caring things that you can do as a family member or community member is to be prepared yourself to how to navigate a mental health or substance use crisis. And QPR is one way to do that, but educating yourself, having your own coping resources, having conversations with people. It's hard. I have teenagers. It's hard to have those conversations with your teenagers, but this is an important topic and they are talking about these things. And actually teenagers now are much more open than, 20 years ago, say, about talking about mental health. And so have those conversations, be willing to talk about mental health openly with your family members, with friends, with other people that you work with, and having those conversations and saying it's okay to have a bad day can create space for people to bring forward what they're experiencing and have a conversation about it.
Because we're also pushing out a lot of information to students about mental health resources, and there's like tracks and all these things in student success. But one thing I always remind them of is to, most of our students are 18 and over. So this is also a resource that they can use, which I'm not sure that they're all aware of. But anything you want to say about, an 18-year-old coming in? I mean, you might be coming from like Eastern Kentucky and never been to Lexington before. And I can imagine it would be scary to drive out to Eastern State to seek help, but
yeah, we see lots of students. I myself have sat and had therapy sessions with students who are struggling. They feel like they haven't found their place. They haven't found their group. They don't know if they can continue to go on and do what they're doing. And Empath is a great resource for that. Just having the ability to decompress, to get medications, to see a therapist and say, where do I go as the next step for this, can create space for hope. And that's exactly what we want to do.
Yeah, and all the same things I think applies to what Lindsey was saying earlier, having the bravery, the training first, right? But the bravery to be able to say, how's your head? That's a statement I usually use with my son to sort of start that conversation. And then I'll ask more, direct questions. But yeah, having that training and that bravery to be able to say to the roommate, how are you doing? I'm noticing this. What are your thoughts like? Having that bravery to be able to do that. But also, I think too, as a new student out on your own for the first time, sometimes we neglect all those basic things we talked about earlier, like exercise, sleep, nutrition. Are you eating right? And then sometimes going out and having behaviors at the bars and parties and things like that that maybe is kind of a new piece. So it's throwing another variable into your overall behavioral health, mental health, and overall health, really.
Do you happen to have the URL for QPR training handy?
Yeah, so it's kyqpr.ukhc.org.
Dr. Lindsey Jasinski and Dr. Marc Woods, thank you so much for joining us today on Behind the Blue.
Thank you so much for having us.
If you or someone you know is struggling, help is available. UK Healthcare's Empath Unit is a new emergency unit dedicated to the treatment of patients experiencing a mental health crisis. Located on the campus of Eastern State Hospital at 1350 Bull Lee Road in Lexington, this unit is open 24/7, 365 days a year, and is designed to provide immediate access to mental health care and resources. Referrals are not needed to come to Empath. You can also call or text 988, the National Suicide and Crisis Lifeline, to speak with a trained counselor, free, confidential, and available 24 hours a day. And for Kentuckians, free QPR or Question, Persuade, Refer training is available at kyqpr.ukhc.org, a 1-hour course that could help you save a life. Thanks for listening to Behind the Blue. Behind the Blue is a joint production of the University of Kentucky and UK Healthcare. For more stories about UK and UK healthcare, visit uknow.uky.edu.